You know,
Trust.
it's amazing that you say that, because I can't think of a time that a patient has said, "Doctor, thank you so much. You know, the margin on the distal of number 14 definitely is far more optimal, and
Exactly.
that contact
Right.
is excellent." No
Right.
patient says that.
Ever in the history of man.
How do they evaluate the quality of your dentistry?
Right.
Are they comfortable? Have you gotten them out of pain?
Right.
Does everything feel good?
Right. Or does that margin look like Picasso did it? No. No, nobody's ever said that. Right.
So,
No.
how interesting. When I think about some of the other times in a dental practice that a patient experiences pain, I do think about injections. That is a time. And one piece that I do want to share is, although this device is terrific, there still are times when we do need to use injectables.
Of course.
So I work in a perio practice,
Yes.
so for periodontal surgeries and things like that, yes, we are doing injectables.
Yeah, tell me about
that. Well, actually, what I want to ask you first
Yes.
is, can you use this device for pre-injection?
Oh, it is an absolute game changer beyond comprehension. So with the use of Articaine, we don't have to get so many areas numb. We can just kind of infiltrate. Let's say you're going to do 21 buccal. Rub this bad boy on for a minute.
Yep.
No topical necessary. Rub this bad boy on for a minute.
No topical
No
necessary.
topical necessary. Boom. Get them numb. And the dreaded palatal.
Oh my gosh, who doesn't love a good palatal,
Ooh,
right?
yay.
We all have a little bit of PTSD from having those nasopalatines
Yes.
done on us.
Oh my God. Yes. Give me 4 more.
Just
Yes.
go.
Yes.
I found a way to get around that. If you're a dental or dental hygiene student, have the instructor demo, because at least they know how to do it. Yeah, there you go. Because otherwise it's super uncomfortable.
Oh, it's terrible.
When we come to pre-injection, yes, I would say the
it's huge.
palatal is the worst. Working in a perio practice, how often do we do palatals?
Every day.
All the time. All day, every day. And this is how we all feel about palatals. And so if we can relieve that by using the dental pain eraser, the device itself will actually sit in the area. So if you're talking the nasopalatine, we're talking that little incisive papilla.
Right.
Let's say you're doing a GP, right at that junction between the palatal bone and that alveolar shelf. Yes.
Yep.
You kind of move this in a circular motion, about 30 seconds to a
35
minute, right?
30 to 45 seconds. Yep.
And then you're going to go ahead and inject the patient, and the patient's actually going to get comfortable.
Quickly.
This is really impressive because, quite honestly, I would say not only is this perhaps the most uncomfortable piece for us, but patients know this.
Absolutely.
So if I can give my patient a palatal injection, and for the first time in their life,
Yep.
they're saying, wait a second,
Right.
every other time I've had this done, it's hurt me.
Right.
But you didn't hurt me. Does that not build trust? Does that not bring patients into our practices?
Left and right.
Absolutely amazing.
So it's a marketing machine.
It really is.
It really is. It's a marketing machine. Right. You want to
incredible.
have doctors. Do you want to have patients talk about you? Use this.
That's right.
Yeah. It's
Absolutely
that simple.
amazing.
Yeah.
So
it is.
incredible.
It's amazing. Yes.
So when we talk about using this in a perio practice,
Yeah.
because
Tell me
as
about
you
that.
know,
Right.
dental hygienist here, right?
Yeah.
So we use this for different modalities. And in a perio practice, a few interesting pieces I've found. One, if I probe a patient, not if, when, I'm always probing
Yeah,
patients.
you're-
Kind of my
you
favorite
wake
thing
up
to do.
probing.
Yeah,
Right,
I
exactly.
do. I wake up probing. I'm like, oh, what are we going to do today? We got some perio going on. It's my favorite thing to do, to stab my patient in the mouth with a tiny little sword.
Hello.
And
Yeah.
let them bleed, or
Right.
pus. It's even better.
Oh.
And the important thing when I'm
Chills.
probing, I know, right? The important thing when I'm probing is oftentimes my patient will come in and they're not uncomfortable until you start probing, right? You start probing that ulcerated sulcular epithelium. Oh gosh. And now the patient's uncomfortable. So they
right.
think the reason why they have that disease is because I made that pocket.
The fickle finger of fate
Right?
pointing to you.
That's right.
That's right.
That's right. And it's interesting what happens when you transform the way the patient experiences a periodontal probing examination.
Absolutely.
It's been absolutely critical.
Yep.
We also have behind us several wonderful dental hygienists who practice here in the
Chicago.
beautiful state of Illinois. And they work in mobile dental clinics
Yes.
and public health settings where oftentimes a patient is coming in and saying, I have pain, I don't know where it is,
Oh, right.
but
Exactly.
I think I have pain. And so they can actually use this device during the new patient exam
That's
to
right.
identify exactly which tooth is
That's right.
causing the problem, which is
Right.
incredible.
Yes.
Then we talk about implementation. And in a perio practice, gosh, I'll tell you, Dr. Berry, I see patients all the time who have recession.
Yes. Correct.
And with that recession, they have dentinal hypersensitivity.
All day, every day.
You know, and this is what's so weird. I don't understand this. At some point, some dental hygienist started just like slathering on topical anesthetic onto this dental hypersensitivity. Like that's supposed to work. Now, I don't ever remember learning in school that if you use topical benzocaine, that it will penetrate the dentinal tubules. It just doesn't work on hard tissue. It works on non-keratinized tissue.
Right.
And so we find, of course, that patients are still uncomfortable and sensitive. We've got the white knuckles on the chair, and those are the patients that just dread it, right?
Correct.
They absolutely
hate it.
dread coming in to see us.
Exactly.
So now we've transformed the way we're able to deliver care for our patients with the use of the Synapse Dental Pain Eraser. We're able to apply this into any areas where the patient, because they'll point to it, right? Don't put the water squirter thing here, right?
Right.
They're gonna point directly to the area.
Your squirt gun. Don't put it there.
Don't put that there, right?
Right.
So now we're able to effectively erase the pain perception that our patients are experiencing so we can actually deliver the level of care we need.
Right.
It's interesting. I read a research study the other day that said, and this sounds obvious, but you know how we are, we need the research study to back it up.
Absolutely.
It said, if we, as the provider, if we know that the patient is comfortable, we will do a more thorough job of debriding the patient.
Hands down.
Right?
Hands down.
That means if I'm approaching a patient and I'm doing scaling and root planing and they say, I don't want any anesthesia, why do they say that? Because they don't want to get stuck with a needle, they don't want to be numb, they have a meeting afterward, all these things, right?
That's right.
So they have all of these objections. Well, here's the issue. If I don't effectively get my patient comfortable,
that's right.
The research says I somehow, on a sympathetic level, am going to hold back from truly debriding, getting to the base of that pocket or treating my patient.
Because you don't want to hurt them.
Right.
Intuitively, you don't. Right.
This person who hates me is,
Right.
of course, not getting the full level of care that they need.
Exactly.
So this has truly been able to, allow me to reach the areas that I need to with my patients. It's allowed me to help my periodontal maintenance patients become comfortable. And it's been absolutely terrific for our pre-injection, because I can't tell you how many times I'm doing palatals for my doctors for those connective tissue harvests. So now it has created a really beautiful, comfortable experience. One final piece I do want to ask you about.
Yes.
And I love this. This device was actually invented by Dr. Cosmo. Dr. Cosmo is a practicing orthodontist.
It's incredible. What a genius.
He is a genius.
He is a living genius.
He is such a brainiac. I'll send him podcasts sometimes. I'm like, what do you think about it? He's such a genius. Like, it just cracks me up. But he developed this as an orthodontist for his patients.
Right.
Tell me a little bit about how you could use a device like this for ortho cases.
So we only do the clear aligners, and Dr. Cosmo has an ortho practice up in Rhode Island, so he's doing traditional braces. Sure. And when he's doing it for his patients with traditional braces, that first day, well, you can get quite religious when they tighten those wires, let me tell you.
Cats? Oh, yeah.
Oh, yeah. Mm-hmm. So what happens there is they get the take-home unit, and voila, you show the patient, we'll do the training for you. You rub it on your gums and the tooth in case it's bothering you. Training's over. Yes. Yep. All right. And you dispense it to the patient. The next thing you know, they're in control.
Right.
And they feel empowered. They feel better. And they feel, most importantly, you care.
Right.
People don't care how much you know. They only want to know how much
you care. Oh, my gosh.
Boom, right?
There it is. Boom shakalaka.
Absolutely. Same thing with clear aligners. Clear aligners, first day, it's tough. You have those engagers. Oh, my gosh. You've spent an hour in a chair, and the next thing you know, Mrs. Jones, let's take this home. I'm going to give this to you. Oftentimes, we give this to the patient. We don't even charge them because it shows we have a higher level of care. And in this recessionary times that we're experiencing right now, we need to, as a practitioner, both of us, need to provide a higher level of care and service to differentiate ourselves to weather the upcoming storm.
Wow. I couldn't have said it better myself, truly. And that is what it is. This is not only providing a service to our patients, but setting us apart and helping our patients to understand.
No doubt.
We have curiosity. We care about them, and we want to be able to support them in controlling their pain. We do not want them to be in pain. we aren't.
Didn't wake up this morning. That was on my to-do list, Mrs. Jones.
Let's cause some pain, right? None of us go into dentistry to hurt people. And I did it, right? Yeah. So the idea being, this has now transformed the way that our patients even experience care outside of the practice. So instead of handing them a handful of Tylenol or ibuprofen and saying, good luck with your post-operative care, now we're actually giving them a device that is able to manage and mitigate their pain. What a
Exactly.
beautiful thing for our patients.
And it's so light, easy to use. Again, the training is, we did it. And implementation is easy. Your assistants can use it, the hygienist can use it, the doctor can use it, the patient can use it at home. It almost sounds too good to be true, but it isn't. I can assure you that I use it each and every day. So it has just been a transformative part of our practice, and I hope our patients' lives as well.
Oh my gosh, I love that.
Do you feel that way?
Absolutely.
Yeah.
And it's interesting. We're now starting to get people asking questions like, so could this be used for aphthous ulcers?
Of
Could
course.
this be used for TMJ issues,
go,
right? Could this be used in mobile dental clinics? Could this be used for palliative care? Could this be used in nursing homes?
Right.
And the answer is yes, of course, absolutely.
Yes,
The
and yes.
uses are endless, and I think that's where dentistry is just so excited right now, to be able to see the ways in which we can take this device and really help support our patients
No doubt.
and support the community.
Yes.
So for those of you who are at home watching us here live from the Synapse Dental Pain Eraser booth at gorgeous Chicago Midwinter, if you have an interest in learning more about the Synapse Dental Pain Eraser, or you would like to connect with a team member to learn about how you can integrate this into your practice, click the link in the caption. It will take you to an opportunity to schedule a virtual consult so that you can essentially begin learning how to integrate this into your practice today.
Thank
What do
you
you
so
say,
much.
Dr. Barry?
I say you're a rock star.
All right.
Boom.
Signing off. Thanks,
Thank you.
everybody. Cheers.